Let's give a warm round of applause to the Commissioner of DHSS, Adam Crum. Welcome to State of Reform. Take her away.
Thanks, BJ. You got me back there? All right. So what's everybody waiting for? So, I'm not sure what all the fuss is about. This job is completely stress-free. Wow, it has been a crazy 10 months. So I just want to say from the bottom of my heart, thank you for hanging in there with me. I'll be honest, this has not been an easy year. It started with a jolt, literally, when a 7.1 magnitude earthquake hit South Central Alaska just 3 days before I took office. While my first foray into the department showed the excellent emergency operations teams at HES, the whole saga, including the aftershocks, was quite unsettling. In a way, it set the tone for what was to come. It's been nearly a year of constant challenges and constant change. As a department, we have asked a lot of our partners over the past few months. We're working to implement some significant reforms to address Alaska's fiscal challenges, and it hasn't gone as smoothly as any of us would have liked. I think it's important to acknowledge the struggle and also to thank you all for remaining committed to improving health outcomes for the people of Alaska. Thank you for pushing us to be better, to think more broadly, and for being here today. We can't succeed without all of you. So here is to a smoother 2020. We have grown from lessons learned. My goal for this next year is to come together with all of you, our partners in healthcare, to shape Alaska's healthcare system around what unites us, the health and well-being of all Alaskans. Part of that involves better communication on our end. We're working hard on that, and I want you to know that my staff and I are striving to be as accessible as possible to you. Mike, I owe you a phone call. You'll be seeing more from us on that front in the coming months, from open meetings on Medicaid to supporting health governance efforts and provider open houses at medical facilities by our Chief Medical Officer, Dr. Ann Zink. We are facing unique challenges at this point in our state's history, but this is certainly not a new problem to solve. Healthcare reform is an ongoing process, and it won't happen overnight. Thankfully, much important work has already been done by many people in this room. But clearly, more serious reform is needed. We all know it. That video stepped on a lot of my speech notes. The United States has the world's highest healthcare costs, and Alaska has the highest per capita healthcare costs anywhere in the nation. We do like to say Alaska is open for business. But a sad truth is that the high cost of healthcare is a weight holding back our businesses, our schools, and a drain on our government. It affects every industry, every sector. I think I lost you. There we go. For example, 71% of young Americans between the ages of 17 and 24 are ineligible to serve in the U.S. military because of health problems, including a lack of physical fitness, a lack of education, a criminal background, or a combination of factors. Even the Business Roundtable, a nonprofit comprised of the CEOs of leading U.S. companies, recognized the need to address healthcare when it redefined the definition of a corporation to include a significant investment in the health and well-being of employees and communities as part of what corporations ought to do. Clearly, businesses and the military see the need for further healthcare reform. Nationwide, healthcare costs are fast approaching nearly 20% of the gross domestic product. That's a huge portion of our economy. But there is a flip side. Healthcare is also one of the strongest, most robust segments of our economy. As we work to restructure our healthcare system in Alaska, we need to keep sight of that and make changes carefully to help us all grow. Healthcare is complicated. You all know this. It requires a balance and a partnership between private businesses, the federal government, our tribal partners, state government, and stakeholders across a geographically and culturally diverse state. What works in Anchorage and Juneau may not work in Dillingham, Copper Center, or Kaktovik, as federal regulations made for states rarely always fit. Understanding our constraints, yet striving for innovation, is how we are going to come to solutions that lead us into the future healthy and strong. Healthcare is also personal. From the work of traditional healers, to the trusted relationships between providers and patients, to a respect between state and federal officials, Healthcare is built on relationships. What constitutes health and well-being is different for every individual, and what HES does affects every Alaskan, directly or indirectly. Our department's mission is important. At the end of the day, there is nothing more personal and more meaningful than the health and well-being of Alaskans. We must find a way forward together, and it is through that lens that we bring a vision for the future. I knew this job would be demanding. Some days it does even seem impossible. But I like a challenge, and service to others has always been important to me. Some may have heard that I was frustrated to read the Ombudsman's report from May 2018 about the Division of Public Assistance, which found that they had not met legal timelines for processing applications, did not respond to communication from the public, and performed work in an inefficient and ineffective manner. At the time, there was a backlog of more than 20,000 cases involving Medicaid, Denali Kid Care, and other public assistance programs that had been building for years. I knew we could and should do better. So we have made direct efforts to tackle this issue by enabling and supporting decision makers in the division. By March of 2019, the backlog of DPA applications was down to just about 7,000. I am proud to say that today it's down to less than 700 cases. And just like DPA, there have been other tremendous successes we can build upon. The 1115 demonstration waiver provides us with a bigger and better toolbox to address the behavioral health and substance use disorder needs of chronically underserved Alaskans. This waiver, a Medicaid transformation project created by Alaskans for Alaskans and approved by CMS, focuses on prevention. It includes increased screenings and assessments, funding for peer-to-peer support, improvements in coordination with the Office of Children's Services, and much more. In the end, we will have more resources for our most vulnerable closer to home. Already, 23 new services are now offered through the 1115 waiver, and these are services that span the continuum of behavioral health care. This is not only better for Alaskans, but will save us money in the long term. We continue to transform state government to be more streamlined, efficient, and effective. Public health nursing is working in collaboration with hospitals, communities, and federally qualified health centers to work together on assessing health needs in communities across Alaska. This is to both prevent infectious disease outbreaks and address ones that arise, but also to improve the overall health of local residents and address social determinants of health before they become a factor in decreasing health outcomes and increasing health costs. Other states are taking note of public health nursing's transformation into agents of change and are asking to learn more about our place-based system designed to help individual communities in unique and precise ways. I also want to celebrate the successful legislation setting up and continuing both the SHARP 3 and the vaccine assessment programs. These are both great examples of public-private partnerships that both save the state money and make life better for Alaskans. AVAP pools money from insurance payers to buy vaccines at a cheaper rate, both promoting health and saving money without costing the state. Likewise, SHARP 3 doesn't cost the state any money, but leverages the state's unique role to get tax-deferred loan repayment in order to bring quality healthcare providers into Alaska. Both are win-win situations and the kind of creative solutions we need more of. These are small steps in a much larger transformation taking place. It's been a tough year, but we have much to be proud of. We can do more, and rest assured we will. Our department is the Alaska Department of Health and Social Services. This makes us large and complex, but it also helps us work across divisions and think broadly in how the pieces make up the whole. This is a critical approach when we know from the Institute for Clinical Systems Improvement that only 20% of an individual's health is made up by the quality and available access to health care. An additional 30% is made up of our health behaviors, 10% our physical environment, and 40% is due to socioeconomic factors. Because we provide a wide range of services at HES, from womb to tomb, we have a unique opportunity to address healthcare in a more thoughtful, comprehensive, and intentional way. That's why I'm choosing today not just talk about Medicaid, but talk about health and well-being. We will save money for Medicaid by addressing healthcare more broadly, as Medicaid is just one part of our larger department. We cannot cut, grow, or change Medicaid without thinking about the other factors that determine our health, as well as the impact that Medicaid has on the ecosystem of healthcare as a whole. Fundamentally, Medicaid is health insurance for almost 30% of Alaskans through a partnership between the state, the tribes, and the federal government, and delivered primarily in the private sector. Because of its size and relative local control, it has and will continue to serve as the engine for healthcare transformation in Alaska, as it has in so many other states. One of the best things about Alaska is that it's a big, small state. Our population is right around 740,000, spread across over 650,000 square miles. But instead of 6 degrees of separation like most people experience in Alaska, it may be 2. We're connected, and just like politics, healthcare is local. So what is our vision? Where do we go from here? First off, we must think more in terms of communities. As Alaskans, we are proud of our communities, and we stand up for each other. It is time to take our healthcare dollars and align them in ways that promote the health of everyone in a community. We need to build up the connective tissue of communities to help make us strong and resilient, empower the relationships between providers and patients, because at the end of the day, it is relationships that matter. We need to find a way to promote and pay for real health care instead of sick care. We will strive to not make systems efficient for efficiency's sake, but to really help patients be better off. And the data is clear. When you support communities, you save money in healthcare and people do better. That's why we owe it to Alaskans to make Medicaid make sense for individuals, for communities, and for the sustainability of our future. The second goal is to align payers, providers, and communities to better support high-cost individuals and high-risk groups. We know nationally that 5% of the population accounts for 50% of healthcare costs, and this does not take into account other costs that the state may pay for this population, including corrections, senior services, and the Office of Children's Services. These complex situations challenge us all to think broadly about chronic or serious disease, mental health, end-of-life care, substance abuse, and the impacts of trauma. By uniting around key populations, we can both build alliances inside the state as well as with our partners as we improve the health outcomes, find efficiencies, and decrease cost. The third goal is to move the conversation beyond Medicaid. We have to actively address the rising costs of healthcare to provide a more stable and affordable private market. This will require active engagement with stakeholders to tackle this issue. We will need to improve our data for real-time clinical care. We will also need a better understanding of the cost of care as we work with all of you and our federal and tribal partners to make healthcare work for all Alaskans. As we grow and learn, we also are bringing in outside perspectives to help us. I'm excited to announce today that we have hired a Medicaid senior advisor and strategist. DHSS has entered into a contract with Rich Albertoni of Public Consulting Group. He'll be a tremendous asset as we look towards strategies that reduce costs but increase value in the Medicaid program. This will be a continuance and it'll consist of collecting ideas that have been successful nationwide, but also building upon ongoing efforts with the state. In addition to the advisor role, we are also conducting a broad search to hire a deputy commissioner for Medicaid and healthcare policy. The state plays a unique role in this transformation, and as commissioner, I'm honored to be working with you, and I'm also very eager to be part of the change. But much like rowing a boat, it's time for us to put our oars in the water and start pulling together in the same direction. No one benefits in the long term by holding on to the status quo. All hands will be needed on deck to work towards reform. And that work begins by building or rebuilding relationships and communicating better and more frequently. Healthcare is 2 words, health and care. I often reflect on the second word, care. Far too often it does get forgotten. But that is not who we are. It's not like us to forget the care part. We are Alaskans, and our small state and our tight relationships are our quiet strength. So let's care for our communities, for Alaskans and each other. Thank you.
All right. Want to grab a seat with me? Let's see if we can keep the conversation going. You pick a side.
Which one's the hot seat? This is where I get to ask DJ questions?
My answers are boring, and nobody cares about my answers. Let me sort of go back to the beginning where you talked about getting your feet on the ground here.
Oh.
As a private sector guy now in the public sector, what has been the biggest kind of surprise about taking on this really massive role at a difficult time financially? what did, what is the biggest aha moment for you personally as you've taken on this position?
Aside from the fact that it's such a big department, I think I'm down now to about once a month where I say, we do that. It would have to be the fact that coming from industry, being a private sector guy, and believing in the free market, you understand what healthcare people have always been saying is healthcare is not predicated on the free market. The rules and parameters and the way the systems are designed actually change the rule book. And so learning how to work in that ecosystem and how we all play together has been a very big personal growth moment.
Yeah. And you have, of course, a graduate degree in public health world. How has that sort of academic training infused some of the cultural piece, some of the cultural interactions and cultural leadership you have at an agency that's much more than public health?
Well, having that background actually means when I have certain conversations with staff, my nodding, I get away with a lot more. But it's just interesting looking at the way prevention plays into it and how we're actually working into this. So our new director of public health, Heidi Hedberg, has really taken the ball and ran with it, and using our CMO, Dr. Zink, trying to get out in front of healthcare costs and prevention. And what can we do as a state to empower our communities? And that's the prism upon which we're looking at this, is how do we get up front and stop being reactive and try to be proactive and help our partners?
The level of frustration is common for people coming from the private sector into government. The level of frustration is common for people trying to reform healthcare. The Walker administration, of course, had SB 74, and the legislature at the time had SB 74. There were a number of demonstration projects that were anticipated to bend the cost curve. There are a number of cost control elements that this administration has tried to put in place in terms of Medicaid and other lines of healthcare. None of those are easy. Few of them seem to, we haven't found the silver bullet yet, right? So what is that like in terms of the frustration of trying to move the ball forward? Your administration, obviously the previous one too, you can't speak to that, and running into just real world obstacles.
The nice thing and very unique about coming in at this time is I don't have to prove that the situation needs to be looked at, needs to be evaluated. All of the stakeholders actually agree of the situation we're in. And so we just have to actually look as a collective, what ideas are going to work for Alaska and how do we move that forward? And so it's really just enabling. If you work in government, you hear this all the time, breaking down silos. But it's just getting people to talk to each other about the good work that's already going on and how can we actually align and find functionality. And the biggest thing is just to keep the point on the mission. What are we there to do? We're there to serve these individuals, these people in a time of need, and to provide these services for stronger communities.
This is sort of a in the weeds question that you know more about than anybody here, which is why I'll ask it. OMB had centralized budget authority at the outset of this administration. It sounds like that's changing. Can you give us sort of a status report on how you will, to what degree you will be sort of responsible for your own budget?
I have yet to meet the new acting director of OMB. I heard she's lovely. We're having a lot of very, very good conversations with the third floor about where we're at and what's the plan moving forward and what can we do. Trying to impress, just everybody, where are we at as a state? What are the next steps we have to do? And, Alaska, we particularly go out to other outside conferences, we are unique in the fact that we actually have a very robust and sophisticated tribal health system. A lot of other states don't have that. And so they have this, they don't have this other level of partners. We're trying to make sure that we're all working together.
Yeah. What do you question that people who are sort of living in the legislative weeds here today said that I should ask about where the supplemental conversation might be headed, and to what extent will we need to allocate more funds to the department in the 2020 legislative session to support the work you're all doing?
That's beyond my pay grade.
Yeah, it's, smart answer, and reminds me that for all of the gnashing of teeth going on right now, I haven't heard a single person say a bad word about you. I've heard a lot of bad words. None of them have your name on them. What is, I guess I would just say accolades and kudos. You started your comments today with some humility, which I appreciated. What has this been like from a perspective of leadership? To try to lead with a positive, humble approach in a time where people have daggers out, regardless of healthcare. It's just a tense time.
It is, and what's made it all the more easier is if you don't work in government, you see a certain perspective, and you may form a conclusion as to, right, nothing ever goes right in government. You actually kind of make judgments. I was that guy walking in. But I am very lucky to be surrounded by staff and team that are very earnest in the work that they do, trying to actually find the right ways to move forward. And that is something that has really helped me as you see how much people want to do this. And so from my perspective, my job is to try to remove barriers from them, to help enable them to actually succeed with the good works that we're trying to do, and to really just help connect the dots. And it's been very rewarding. It's been a long time. My wife the other day says, "Oh yeah, your beard is getting more white." And it's like, "Oh, thank you, appreciate that." It was completely non sequitur out of the blue, but I'll take that. But we have a very big responsibility for what we do, and it's enjoyable, rewarding work. And the nice thing is more and more people as we meet, everybody does want to contribute. They have solutions, we have ideas, and it's trying to put that all down together. And that's what the next goal for the next year is, to actually put together those conversations and put the right people in the room so we can actually get something on paper and move that forward.
A lot of times your job is to sort of provide vision and have people go execute on that, I know. And many issues, maybe dealt at a staff level that don't come to your desk. Mental health generally, API specifically, are certainly things I'm sure that have been on your desk. And what sort of visionary guidance do you give, not the tactical operational work, but what do you tell your team when they're trying to solve a mental health crisis in Alaska and an operational situation at places like API? What guidance do you give them as they endeavor there?
It's API's got its own unique situations, but we're trying to make sure we understand that we're doing the appropriate placement for care and working in that regard, setting the most therapeutic environment as possible, while at the same time keeping an eye on the fact that we have got to build up our infrastructure for the behavioral system. And the nice thing is a lot of work has been done well before I got here. Working with the Mental Health Trust and a lot of the ongoing projects they have, we are so close in Alaska to getting the correct things in place to really help. And this will actually affect across the board too. This will affect public safety. This will actually help on our pathways to reducing recidivism. And it's a critical aspect in this entire wheel.
Mm-hmm. Notably, of course, Alaska is always dependent on federal partners, but that's particularly the case in Medicaid and in healthcare. We have at least one or two people in here who think about federal policy often. Senator Murkowski is hanging out here. How do you solve healthcare? Well, rather, the answer is you can't solve healthcare in Alaska without federal partners. What are the conversations that you want to be having over the course of your administration with federal partners in terms of trying to change or reform the healthcare system? Where does that partnership come into play here?
We've had some fantastic conversations with our congressional delegation and staff. They've been actively involved. Senator Murkowski's staff meets with us frequently. And really the conversations we're trying to have is, how do we get the most flexibility for Alaska? Is because we are such a big state. We have different systems set up. We have unique rules, we have unique challenges that federal rules sometimes impede us from doing it just the best, most pragmatic way possible. So a lot of our conversations are, how do we gain that flexibility so we can actually do the job better? To me, efficiency is, if the smoother we do it at the department level, that's more dollars out the door for services for those who need it.
We talked a little bit in advance of this about other states that you have a particular personal interest and, of course, department-wide interest. What are some of the things that you see other states where you are learning from what they're doing and things that you might want to employ here?
You look at other states. Washington uses their CMO in an analytical and a quality-based role, which is very interesting to make sure you have that glue and that connective tissue we were talking about. Oregon with their coordinated care operations. Other states, the way they're broken out and their different focus. But the nice thing is we look at the mountain states in the Northwest, Region 8, Region 10. Been building up relationships with the health secretaries in the other states, and just had a meeting last week in Denver. We sat down together, and it was really refreshing and invigorating to me, because there's 4 brand new health secretaries less than a year on the job, and we all sat down and we all said, nothing you do before this can prepare you for this role. So we all felt better after that, because this is not something that you walk in and do. The key thing for me is, I understand this is not me to come in and save the day. This is me to come in and actually just help the work that's been going on to make sure we can push it over the goal line. I'm a football player, so forgive me my football analogy.
Yeah. So you spoke to this in your comments, but what can these folks do to help you and your department, you and your policy team, you and your operational team, what kind of input or feedback or partnership would you like from this room of healthcare folks?
Honest feedback and dialogue. We're being able to roll a little bit more into what we call the governing phase. We can sit down and actually capture the information. There's a lot of good stuff that has already been done, but you guys are the boots on the ground. You're the ones out there delivering it. You know, as we specified in my speech, it is not a government-delivered healthcare system. It's delivered by the private sector and our partners there. And so we actually have to find a way to work together, because while we may be the payer in some instances, you guys are the ones who have to deliver that level of care and deal with those individuals and make sure that they're living their best life. And we want to make sure that we can actually support that together to give you the tools necessary.
Commissioner Adam Crum of DHSS, thank you, sir, very much. Let's give him a round of applause. Sir, thank you. Appreciate it.